afternoon, students. Welcome in HCP Practical. Today I will start the experiment number 30, and title of today's experiment is to understand the role of pharmacist in improving patients' compliance. Okay, what is title? To understand the role of pharmacist in improving patients' compliance. Then prior concept community pharmacy. Then new concepts for compliance and non-compliance. Then pharmacist role. Then learning objectives are intellectual skill and motor skill. Now see, the first is intellectual skill, to appreciate and understand the role of pharmacist in the patient counseling and service. Then to provide directions for the medications and administration. Then motor skill is ability to communicate using the simple language. Then ability to convince the patient. ओके, तर लर्निंग ऑब्जेक्टिव्ह तुमच्या काय आहेत, तर तुम्हाला जे डायरेक्शन्स आहेत त्या तुम्हाला हे प्रोव्हाइड करता आल्या पाहिजेत. ज्या मेडिकेशन्सच्या डायरेक्शन आहेत ते प्रोव्हाइड करता आल्या पाहिजेत किंवा ते ॲडमिनिस्ट्रेशन करता आल्या पाहिजेत. देन मोटर स्किलमध्ये काय सांगितलं आहे तुम्हाला, तर तुमची ॲबिलिटी पाहिजे की ती जो पेशंट आहे त्यांच्यासोबत तुम्हाला सिम्पल लँग्वेजमध्ये कम्युनिकेट करता आलं पाहिजे. त्याच्यानंतर ते तुम्हाला पेशंटला तुम्हाला कन्व्हिन्स करता आलं पाहिजे एखाद्या ड्रगबद्दल, किंवा त्याचे प्रिकॉशन्स असतील, डायरेक्शन असेल, यूज असेल, ते तुम्हाला कन्व्हिन्स करता आलं पाहिजे. Then stepwise procedure. The basic elements of the good clinical pharmacy practice includes: first is the communication, second consulting, third counseling. Okay, then World Health Organization defines compliance as the faithful adherence by the patient to the prescriber instruction. Okay, then non-compliance is the term which refers the fault of the patient for inappropriate use of the medications. Then well-informed patient exhibit the increased compliance with drug regimens, resulting in the improved therapeutic outcomes. Therefore, the pharmacist has responsibility to properly inform patient about the drug therapy. Then pharmacist is the professional who supervises the dispensing of the medicines immediate before use, and therefore assumes the key role in the making certain that potential non-compliance is reduced to the minimum. Then clinical pharmacists at hospitals or retail stores make significant contribution towards improvement in patient compliance by following simple guidelines described here. Then step first is the simplification of the therapeutic regimens, and second is the improving standard of the dispensing notice. Okay, then third is the development of the suitable medication packaging, and fourth is the supplementary labeling, and last is the patient counseling and the education. Okay, now see, the first is the simplification of the therapeutic regimens. Physicians must prescribe a minimum numbers of the drug with well-defined dosage schedules once daily. Then dosage may be recommended wherever possible. A single dose of the drug like phenytoin, propranolol, or antidepressant may also promote compliance by reducing side effects. Okay, here are the once daily dosage may be recommended wherever possible. A single dose of the drug like phenytoin, propranolol, or antidepressant may also promote the compliance by the reducing side effects. Then second is the improving standards of the dispensing practice. Okay, in that the container size should be selected to accommodate a label bearing dosage instruction which are precise, explicit, and in large, easily readable type. Then high quality container should be selected. Pharmacists should take a initiative to detail the ideal time of the administration. Then instructions such as take as required should away be accompanied by the warning which specifies the maximum numbers of the dosage that can be taken in the 24 hours period. Extract mode of the administration and storage condition should be illustrated. Okay. Then third is the development of the suitable medication package. In that, pharmacist should select the system of presentation or packaging of the medicines which is most appropriate for the need of individual patients. Unit dose packaging, that is UDP. Unit dose packaging in general and the blisters pack in the particular encourage a degree of the self-monitoring of the drug intake. Then this can improve the compliance among the selected, intelligent, motivated patients such as the young woman taking oral contraceptives or young adults taking 10 days course of the antibiotics. Again, development of the suitable medication packaging. The pharmacist should be select a system of presentation of packaging of medicines which is most appropriate for the need of individual patients. The unit dose packaging is the general and the blisters pack in the particular encourage a degree of the self monitoring of the drug intake. Then this can be improve the compliance among selected, intelligent, motivated patients such as the young woman taking oral contraceptives or young adults taking 10 days course of the antibiotics. Then fourth is the supplementary labeling. These instructions are recommended to convey important data regarding drug administration. Some of the suggestions for making these labels are: first is the description of the drug action may be given in lay terminology to reduce confusion and improve compliance. Then symbols and graphics may be used to emphasis of correct time of the administration. Then detail which are of interest to the patient may be highlighted by placing them in the front of the bottle. Then a daily calendars or a tablet identification cards. Third, the daily calendars or a tablet identification card bearing details of the administration schedule may be given to the improve compliance. Then now see the first and last is the patient compliance. Fifth and last is the patient counseling and education. In that, using suitable verbals, then written or audio visual communication techniques and methods, the pharmacist should inform, educate and counsel patient about the following terms for each medication in the patient drug regimen. First is the name. In that, trade name, generic name, common synonym and other descriptive names. Second, intended use and expected actions. Then next is the route, dosage form, dosage and administration schedule. Then next is the special directions for the preparations if any. Then next is the special directions for administration. Then precautions to be observed during the administration. Then common side effect that may be encountered include their avoidance and action required if they reoccur. Then next is the techniques for self monitoring of the drug therapy. Then proper storage, potential drug or drug food interaction or other therapeutic contraindications. Then prescription refill information. Then action to be taken in the event of the missed dose. Then any other information peculiar to the specific patient or drugs. Then last is the selection of non-prescription drug. Okay, that is OTC drug and their use. Okay. These are all about the patient counseling and educations. First is the name, then intended use and expected actions, then route, dosage form, dosage and administration schedule, then special directions for preparations if any, then special directions for administration, precautions to be observed during administration, then common side effects that may be encountered including their avoidance of the action required if any there if they reoccur. Then techniques for self-monitoring of the drug therapy, proper storage, then potential drug or drug food interaction or other therapeutic contraindications, then prescription refill information, action to be taken in the event of the missed dose, then any other information to the specific patient or drug peculiar to the specific patient or drug, then selection of the non prescription drugs, that is OTC drugs, and their use. Okay, these all are about the patient counseling and education. Then last is the questions. Okay, this important question related to this experiment. After watching this video, you all students are able to answer this question. Now I will stop here. Thank you.